listening to the myPET podcast, the show for pet lovers of Australia and around the world.
Hi, welcome to the myPET podcast. I'm Aria and I'm here with our resident vet, Dr. Glenn.
Hello.
We're here to talk about senior pets today.
Absolutely.
So just remember that this is just general advice. For advice specific to you and your pet's needs, please contact your veterinarian.
Sounds good.
So, senior pets, they need a little bit more extra care, a little bit more fragile as they age.
They can be, yes. They're, a big part of our families. They've been in the families for a long time.
Yeah.
There is a bit of variation on what is a senior pet, I suppose.
Yes.
Yep.
What does make a pet a senior pet?
Their age in general, but but when you're talking about, dogs, okay, little dogs age a lot slower than big dogs. So if you want to put names and tags on things, okay, I count, and most people count 7 years of age for dogs as being a senior pet.
Yep.
But there's some flexibility in there, as in if you've got a massive Great Dane that's 80 kilos, that pet is going to be a senior pet like at 5.
Yeah.
And littler dogs, okay, maybe you could say that they're senior pets when they're 8 or 9 years of age, because hopefully they're going to last till they're 15, 16, 17 years of age. But if you say 7 years, that's a good line to draw. And cats, most people sort of say 8 years, because again, smaller animals tend to last for a bit longer, thankfully.
Yeah.
So that's sort of the general definition as far as when is my pet a senior pet.
Yeah.
Yeah.
Yeah. And so when someone's pet's getting to that kind of age, what should they be thinking about doing? Should they be looking at going to the vet a little bit more frequently for checkups?
Absolutely, yep, because if you think about dog years and cat years versus human years, 1 year in your pet's life is really like 7 or 8 years in our life.
Yep.
So my standard recommendation is definitely yearly checkups for pets over 7 years of age, and ideally it'll be every 6 months.
Yeah, okay.
Yeah, because so much happens in such a short amount of time.
Yeah.
Most things with senior healthcare, it's, okay, the earlier we can diagnose something or the earlier we can pick up on something, the more options we've got to do something about it.
Yeah, definitely catch it early and make sure that they, get on top of it early.
Yeah, and just make smaller changes earlier that can make big changes later on.
Yeah, that's awesome. Yeah. What kind of struggles do older pets have, and what are you looking for when pets start to get a little bit older?
Oh, look, there's heaps of different things that starts to go wrong, and the main thing is age isn't just the problem. Like, getting old isn't a disease. There's more problems that come on more frequently as you get older, but just because a pet's 12 years of age doesn't mean it's necessarily going to have all those problems.
Yeah.
Age isn't the only factor. There's things that happen more frequently as they get older, but it's not just because they're getting old. There's specific conditions that we can usually do specific things about.
Yeah. So, old age obviously isn't the disease. There's the diseases that they're more likely to get as they get older.
Correct.
Is that right?
Yep.
Yeah.
Yep.
So, arthritis is probably the first one that springs to mind as being more likely to happen in older pets.
Yeah. It's just a lot of it's just wear and tear on the system. So, yes, the older that they get, the more likely they are to have accumulated wear and tear. And there's lots of factors that sort of go into that. And some of those things can be difficult to diagnose early, or people sort of go unnoticed. And then there's they're just getting old because they're getting stiffer to get up in the morning, and they're sleeping more and reluctant to get out of bed, and they just don't do as much as they used to. Well, is that old age? No, they're probably more uncomfortable because they've got arthritic conditions, if that's the reason that they're slowing down.
Yeah.
And again, there's specific things that we can do about that, and getting a diagnosis on, okay, is that what's going on at your vet is very important. But then going down the multitude of anti-arthritic things and preventative and treatments that you can do for arthritis.
It's amazing the difference. It's amazing the difference you can see in those pets once they start getting treatment for arthritis. They
absolutely.
Just bounce back to life.
Yeah.
It's really good.
And it depends on where you are on that scheme of degeneration, because arthritis is a degenerative condition which you can't cure, but you can certainly at any stage intervene with either prescription medications, plus or minus supplements and weight loss and that sort of thing.
Yeah. And so if someone's noticing that their pet is like stiff or lame, so not walking properly, they need to go to the vet.
Yeah, I mean, that's the best way to diagnose, is it arthritis or is there another specific condition going on? I mean, bigger dogs, we have bone cancer troubles and all sorts of things. There's other causes for just being stiff, and cats, if you're talking about cats, I mean, a lot of the time you don't get specific lameness troubles in cats. You get just failure to jump up on the furniture as much as they used to. I mean, just general less exercise in general, is a problem. And again, if they're exercising less because they're in pain from arthritis, well, that's just not because they're getting old. It's because they're in pain from arthritis, and there's something you can specifically do about that.
Yeah. And so I guess on that note, it's a good place to segue into dietary needs, because for joint health, maintaining a good weight is very important, right?
Absolutely. And weight's a two-way street to some extent, because I mean, being overweight, which unfortunately lots of pets are overweight, through their life, and that's through early adulthood and being an adult, and then they can remain overweight or sometimes get more overweight as they get older, because if they're doing less exercise, well, they're going to tend to burn off less energy, and if you keep feeding the same amount, well, they're probably going to tend to put on weight, and that is an escalating problem there. So I mean, that's one thing to consider. Some pets, if they are in pain from arthritis and they're doing this exercise, well, they lose muscle mass. So the weight on the scales, I mean, it counts, but we talk about like condition scores and putting your hands on the pet and saying, okay, we're pretty fat, but we've actually got, muscle atrophy along the top line, and we've got, this right hind leg has got less muscle on it. So, is there a specific condition going on with that leg? So it's not just the pet weighs the same, and I mean, it might be a 10 kilo pet for all its life, but the 10 kilo body composition when it's 12 years of age may be completely different to the 10 kilos that it was when it was running around like a lunatic for half a day as a younger dog. So, condition is probably more important than weight. But yes, we've got sort of a section of pets that are overweight coming into geriatric years, and that's a problem because they wear out faster. And then we've got another sort of class of older pets that have got weight loss as a problem, and there's a number of different causes of weight loss, and again, sometimes that's quite rapid, and if you've got rapid weight loss and you haven't been on a strict diet, well, that's a problem of some description that needs diagnosing, because there's lots of conditions that are more common in older age that do cause weight loss, like kidney disease. You'll get weight loss from peeing out all their protein and the body not working properly. Certainly liver disease is reasonably common, and that they're eating the food but they're not metabolising it properly, so you end up with weight loss for that reason.
That's interesting.
Cats certainly prone both to kidney problems, so renal disease, and that causes skinny old cats, but really quite prone to hyperthyroidism as well. So you get increased thyroid activity in some old cats, which is a specific condition, which again is treatable, but you've got to diagnose it first through blood tests. And weight loss is sort of the cornerstone of that of that condition. So any changes in weight when you haven't sort of changed the diet, I mean, that's something for your vet to look into, and if you're having regular vet checks, well, you weigh them at every vet check, and you're earlier to the party as far as getting on top of those problems. So that's the weight side of things, but yes, dietary requirements do change over time sometimes as well.
How do the dietary requirements change as they get older?
So I mean, in general, they're doing less exercise, so they probably need less energy. So a diet that's more suitable for, in general, older pets that might be a little bit lower in energy, but then some pets that are having trouble maintaining weight, well, maybe they need a higher energy. So it's really can be quite individualised, and again, depends on what illnesses are building up in the system, because I mean, there's some foods that have got like joint diets basically for pets, but then if you're on a joint diet but you've also got a kidney problem or a liver problem, one specific diet may not be suitable for them. You've got other, supplements. So if you've got kidney troubles, or you might be on a kidney diet, but then you need additional supplements to treat the arthritis at the same time. Because you can't. Well, yes, there's kidney diets, yes, there's liver diets, yes, there's joint diets, yes, there's crazy old dog brain function diets, but there's no point feeding 4 different diets at once to try and treat each condition, because you're not treating any of them. So that's where additional supplements and that sort of thing come in for the specific conditions that your pet's got.
With my little old dog, I had a drawer full of all of his old man pills, I'd call them.
Here's your food, and here's the extra stuff.
Yeah,
on,
like
on top.
I'd spend more time making his dinner up than mine.
That happens. I've got a little crate at home on our food prep area, which has got all the arthritic dog and crazy dog and another
crazy
supplements, which is another problem that old dogs get.
Yeah. What do you mean when you say crazy old dog?
I mean, there's a couple of different things go on. There's certainly a condition called geriatric cognitive dysfunction, which happens both in dogs and cats. It's difficult to diagnose sometimes because there is certainly, a specific condition where you've got decreased blood flow to the brain, essentially. So the brain isn't working as well as it should, as a primary thing with blood vessel changes in the brain, but also the heart's maybe not working at 100%, and there's other conditions that are contributing to that. But at the same time, you've got an older pet, and older pets are more prone to having vision problems. So they're getting cataracts, or they're getting other eye disorders that are age-related that, okay, they've got less input, so their vision's decreasing. Certainly there's lots of old dogs and old cats just get non-specific hearing deficits, so they go deaf over time. And that's, again, quite variable. Some of them go deaf quite quickly. Some of them, they've probably been going deaf for a while, but they don't have to listen to the radio or anything, so it's hard to know when they're going deaf, like when they're losing hearing, until it's gone sometimes. And I mean, some of them are, I call it selective deafness, or they don't hear you say get off the couch, but they hear the dog food bag rattling.
Absolutely.
So, because they're stiffer and they couldn't be bothered getting up to all the sounds that they used to get up to.
Selective deafness, I don't think is specific to senior pets. I think a lot of young dogs and cats have that too.
But when they're getting deaf, like are they just doing it selectively, or they actually can't hear it? And I sort of say, if they can't hear the fridge open or can't hear the food bowl, it's a pretty fair chance of going deaf. But and so if they're going blind and if they're going deaf, is there change in behaviour, to be less, maybe less aware of what's going on, less responsive to what's going on? Is that because their brain's not working as well, or it just hasn't got as many inputs? And that's a hard one. And there's diets can be high in antioxidants, which might help with cognitive function a little bit. High in fish oil or omega-3s, which has an anti-inflammatory effect, which might help increase brain function. And there's a couple of specific prescription medications that we give, to pets to try and combat that. But getting to that diagnosis really by excluding other problems is sort of how you get to that geriatric cognitive function diagnosis sometimes. And
speaking of their cognitive function, I think a lot of people underestimate how important it is to have enrichment for older dogs as well. I'm always banging on about enrichment, but I think especially for older dogs who maybe aren't as mobile, or they're not doing as much playing outside because they have limited vision, enrichment toys can be so good for them.
Absolutely. And I mean, they need something, and if they're just little empty vessels sitting around doing nothing all day and then eventually getting up to go to the toilet when they need to, I mean, it becomes a quality of life thing to some
absolutely.
extent.
It's like the doggy version of sitting up and knitting or something.
Yeah, absolutely. And the more they've got to do, and I mean, maybe they've got less physical capacity to do exercise. I mean, exercise is still really, really, really important. And if you don't use it, you lose it, and that's the same in the dog world, basically. So, I mean, having an exercise plan or an exercise regime for your pets as best as possible, and that probably doesn't include chasing a tennis ball for 5 minutes if they're getting old and arthritic, but moving, going for walks both for mental and physical stimulation is a good idea, and just getting out there and moving without doing high impact stuff, or as little high impact stuff as possible is probably a good idea for their physical and mental health. But those muscles are really important to keep moving and keep using them. That's for sure.
Just a little wander in the park.
Or just using your nose, and the nose doesn't seem to disappear. Like the sense of smell just seems to, as much as you can tell, hang around, because there's plenty of blind and deaf old dogs out there that their nose still works really, really well. It doesn't seem to disappear.
That's really, it's good, isn't it? They're lucky that they have that sort of sixth sense in a way, don't they?
It's it's a pretty important sense to them. And we were talking about crazy old dogs, and grayscale cats to some extent. I mean, there is behavioural changes that seem to accumulate over pets' lives, and anxiety probably more so in dogs than in cats. Anxiety is an increasing problem with age, just because they've got more, I think, trigger points over time. I mean, storm phobias and noise phobias and all that sort of thing. That there's very few pets have problems with that when they're 1, 2 or 3, when they're young. But whatever exposure they've had through their life, it becomes a problem, and it's just more likely to happen. And that's interacting with, I mean, pain's a big trigger for anxious style behaviour as well, like being able to not settle at night and the nocturnal nighttime, sort of anxious, wandering around the house, not being able to settle activity. Well, is that anxiety because they can't hear as well as they used to and can't see as well as they used to, and used to know that their owner was 3 rooms away, snoring - sleeping, and they knew where they were, whereas now they can't hear them, so they need to be clinging in beside them, sort of thing. Or is that pain from my back sore, my neck sore, my joints are sore, I can't settle as much as I would like to because I'm just bloody uncomfortable.
Yeah.
Because a lot of those anxious pets, before you intervene with anti-anxiety medications, if you treat for pain, a lot of the time those symptoms decrease or go away. So it's not just it's not just a mental issue. Like, there can be a physical issue inputting into it. And again, that's where your vet check is. And
a holistic approach to it, sort of looking at the entire picture. And
there's just lots of interconnecting factors there, which makes it hard, and that's why senior pet care, it's a really big thing. And when you go to your vet to have a senior vet check, I mean, history is really, really important, and it might take 5 or 10 minutes to just talk about what the pet's up to, because there's so many little hints that you can get from what's changed, what hasn't changed, and when you go to your vet for a vet check, it's make a checklist of all the things that you think might have changed, or little niggles that you're worried about, because sometimes that little thing puts you down a path to finding out what's a major problem, because you live with your pet and you know what used to happen and what happens now, and why has that changed? But it's usually not just getting old.
And so, like, with being unsettled at night, the toilet can be a reason behind that. What kind of toilet troubles do the little oldies get?
Oh, I mean, there's, again, lots of different things going into it. So, I mean, a lot of people report, you're finding puddles where you didn't used to. So that might be puddles in the bed, or they just wander around the house and pee where they didn't used to, or need to go out more frequently. And sometimes it's just, they just can't hang on for as long as they used to. And then that's something that we need to try and accommodate, where they might need more toilet breaks. But at the same time, is that just an ageing problem where they don't have as good a bladder control as they used to, or have they got specific urinary incontinence issues? And that certainly happens, and that is more likely to happen as they age, for hormonal reasons, or again, to do with back pain and arthritis and that sort of thing. Or are they drinking more water, which may go unnoticed, particularly in a multi-dog or multi-cat household, and are they making more urine, therefore they need to pee more, and it's not actually a peeing problem as such, it's an overproduction of urine problem, which could be kidney troubles or diabetes or stuff that you need blood tests to sort of diagnose. So, weeing habits can change over time, but a lot of the time there's a health problem that goes along with it that you can address and needs to have something done about it. And poop troubles, look, to some extent, dogs probably more so than cats, if their back disease is getting bad enough, like disc disease, they can end up with less awareness of when they need to go for a poop sometimes, and they used to hang on all night and half the next day and not have to go to the toilet, but then they start to get sort of caught short, and they mightn't make it outside to go to the toilet because they just haven't got that neurological awareness. And occasionally, further down the track, you'll end up with, poops in the bed and the pet was just asleep and didn't know it happened, sort of thing. And I've had that at my place several times.
Was it the pet or was it you?
No, it was the pet. And it's just if you're doing all the arthritis stuff and everything else, I mean, it just happens sometimes because unfortunately they will continue to deteriorate, and hopefully at a slower rate because of all the stuff that we can sort of help out with. But they are still aging and are going to wear out at some stage, and sometimes that's one of the things that can happen. Yeah.
Yeah. So lumps and bumps.
Yep.
There's all sorts of lumps and bumps that appear.
Yep. And again, dogs seem to get more lumps and bumps than cats.
Yep.
But I mean, dogs, those non-shedding dogs with the little warty-looking adenoma lumps. I mean, dogs that don't lose their hair are a lot more prone to getting those, and they're sort of up to match head sort of size. They're quite common, but again, any one of those lumps could be a potentially nasty lump. I mean, really, any lump that's new ideally should be checked by your vet because there's mast cell tumours and relatively common tumours that can get away really quickly and are really bad news. Look, there's lots of dogs that have got 10 or 15 up to golf ball size lumps underneath their skin, which are probably lipomas, like fatty cysts. But again, we see them all the time, and I usually say, I'm 99.5% sure that this is going to be a lipoma, a fatty cyst, but ideally getting them checked out and a little needle stuck in them and diagnose exactly what they are. Because your pet might have 14 of those style lumps and then gets a different style lump, which can be really bad news. But, certainly not uncommon, and you just lay your hands on regularly, and if something's getting bigger that had been there before but it's growing faster than what it had been before, okay, that's a problem. Or if there's something that's new, okay, that's a problem as well. But certainly not uncommon. Most pets will get a lump of some sort. Most of them are not a problem, but some of them aren't. So again, just regular checks, and you end up with this long list of this is where the lumps are on the dog and this is how big they are, and at 6 months later you can compare, okay, it was 2 centimetres by 2 centimetres last time, and now it's 3.5 by 3.5. Okay, that's growing a bit fast.
So it's a lump inventory.
Yep, there's plenty of lump inventories out there.
And in general, like on a day-to-day basis, what kind of extra little bit of care do senior pets need? Like toenails is one that comes to mind.
Yep, they keep growing just the same as they did when they were young, but they just don't wear them down on average as much as they used to because they're not as active. So you might find that they need to have their toenails trimmed more frequently, basically, particularly those dew claws. But I have little old cats that are old cats and are just getting sore, and you look at their claws and they seem to lose the ability to retract their claws to some extent.
Wow.
And I've seen lots of little old cats where the claws end up growing right back around and through the pad, and it gets nasty because they're not wearing them down as much as they did. So just that regular foot checks, and again, if you've got arthritic feet that are painful feet, they mightn't like their feet being touched as much. But that's, whether your vet can help out with that, for various reasons. But toenails are something it's really common to get overgrown toenails in older pets because they're not wearing them as much. And
then there's the preventative stuff, like prevention with dental disease, like giving, dental sticks and bones, and the sort of the mouth rinsey stuff. What all that sort of thing with older pets?
All those things, and I mean, again, at your regular vet checks, they'll be checking that and making sure that there's no sign of disease going on. I mean, some older pets that have had multiple dentals or have had extractions, it's harder to use dental chews and stuff like that to keep their teeth clean because they haven't got top teeth to chew against with the bottom teeth sort of thing. So you end up with sections of the mouth that it's harder to keep clean, and brushing from an early age is always a good thing. There's not that many people I can convince to brush their dog's teeth, and dogs that are happy to put up with it, and cats are probably even less likely to some extent. But there's other things that you can use, in water additives and that sort of thing that can help with dental hygiene if you've got a specific problem, but you've got to look at it to know that you've got a specific problem regularly.
And I even think just things like making sure they have a nice soft bed, because as they get older, they get a bit more sore to lay down.
Absolutely. I mean, soft bedding always should be offered. In summer, sometimes they'll prefer the cold, hard, cool tiled floor or concrete sort of thing. But if you've got soft bedding on offer, and maybe it's in summer, it's make sure it's a well ventilated sort of soft, hammock style bed potentially. Definitely winter, soft bedding is really important because the cooler they get, the worse their joints are, and things like dog rugs and coats and that sort of thing. Just to try and keep them as comfy and crispy as possible.
Yeah, definitely. Little old man jumpers and things.
Absolutely. Skivvies.
Yeah, even socks.
Yes, absolutely. And I mean, traction on floors is a big thing. So, I mean, some pets will go into booties or grip aids and that sort of thing, stick on claws and stick on pads and stick on little crystals that can help to give them better traction inside, because that it certainly becomes more of an issue on slippery floors and that sort of thing. So just being mindful of the little ways you can make your pet's life happier, basically.
Yeah, that's it. They've given a lifetime of love.
Absolutely.
So we deserve to give them a little bit more attention, a bit more spoiling.
Yeah, and someone's just being mindful of stuff, and if something's changed, seek professional help, realistically. Yeah.
Is there anything else that you want to discuss in particular with senior pets? Anything else that springs to mind?
I could waffle on about all this for hours on each of those topics, but
I know.
No, I think that's sort of a general overview of the things that we can do, and a lot of it starts at your vet.
Yeah.
And if they can't find anything wrong, that's bloody awesome.
Yes.
I mean, most of the time, senior vet checks, you'll be looking at things like blood tests and regular urine tests, because you'll pick up stuff on blood tests that you can't physically see or feel on the outside.
Yeah.
So that's a really important part of senior healthcare is a good establishment of a relationship with your vet, and get those things checked out. And if there isn't anything going on, awesome. We've got a comparison for 6 months or 12 months' time as far as blood tests and urine tests goes, because a lot of that stuff you pick it up early.
Yeah. Awesome.
That's the most important things.
Yeah. Well, I hope that you guys enjoyed listening and learned some stuff about senior pets, and I learned a few interesting facts. And thanks for listening, and I hope you enjoy your senior pets.
Thanks, everyone.
Bye.